Mayor Sabol, Ms. Onias, and other members of the City Council. It seems like it's been a long time since I addressed you all, but I'm here tonight to talk to you about our performance contract. It is a newly updated contract, 233 pages that I have to fulfill all the obligations of this contract. What's new about this contract, it's a 2-year contract, so it runs from 2022 to 2023. There's lots of new initiatives that I'm responsible for the upcoming 2 years. We're looking at gambling prevention. We're looking at services for veterans and services for veterans and family members. We're also looking at expansion of peer services and services for peers and their families. And then one of the big initiatives that we'll be working on is working with the local police department and also the sheriff's office on crisis response here in the community, which is going to be a biggie. That's where we'll have mental health employees respond with police officers to the community on situations so we can get those de-escalated before they reach a potential of where police have to get involved. And you know, if a person is decompensating, we would be available to assist as they respond. So we have a lot of new initiatives we'll be working on. As I said to you all, this performance contract includes lots of new exhibits, addendums, and there's all kinds of new language and definitions. And we're going to try our best to meet all the requirements. Under the code, I'm here tonight to request your approval. We have come up with a proposed budget that we're looking at. And our mental health budget continues to grow. Our numbers continue to grow. We have lots of people that are in opioid services right now, and we have waiting lists of individuals that are needing services. In addition to our intensive outpatient treatment program, because of the inception of the drug court, we have waiting lists for a lot of those folks that are in those services. So we're very, very busy. The pandemic has caused us to have lots of folks to come in from the community that need to be seen, and that's a good thing. But we have come up with tonight a proposed budget of $8,554,420. And of that amount, it's all broken down. If you were to look at the handout that I provided you, mental health services, we're looking at $3,878,640. And we serve approximately 700 people, individuals in those services. Developmental services, we're looking at $3,395,472. And we're looking at now anywhere from 60 to 80 people that'll be served in the developmental services realm. And a lot of those individuals have waivers. And then under substance use disorder services, the budget has grown and we're up to $1,280,308 for a total budget of $8,554,420. Of this cost here, administratively 16.67% represents those administrative positions that take care of payroll, accounts payable, finance, IT, HR, and those types of things. And then, as you can see at the very bottom, our local match contribution with Alleghany County and Covington did not meet the required 10% match, but we're at 9.43%. So we did have to file a waiver this year with the state and show the reasons why we didn't meet the match. And Mr. Bryant also provided us with a letter that we could send in with the state. Almost there, but not quite there. So, but we do appreciate all of the local funding that you provide to the CSB. And I will tell you that most of it goes to serve the indigent population because we are the public behavioral health system here in the community. So I'm here tonight to answer any questions that you have about the CSB. If not, under the code, we would appreciate your approval for this 2-year contract for 2022 to 2023.
When's your fiscal year run?
July to June. Yes.
June, so you're already into this?
Yes, we are. Yes, we have until September to get this approved with both of the localities, with Alleghany County and also with the City of Covington.
Under the substance use disorders, Do you know how many are serviced in that area? You gave numbers in the other.
It's growing. I want to say somewhere in the neighborhood of close to 100 for substance use disorder, and that's individuals that we're providing medicated assisted treatment, intensive outpatient treatment. I'd like to try to get some form of detox services here, and I'm hoping with the opioid abatement funds that we're going to be receiving, we can start that.
You get opioid abatement money?
Well, some of those funds that'll be sent to the localities, I think they have it specific in the language that the CSBs will receive about 35% of that funding. So I'd like to get us some detox services here.
And we're $5,000 from us.
Yeah, we're getting about 24K when the years go around.
Well, it's going to be over a period of 6 years. So any help towards those programs would be appreciated because we're seeing our numbers increase here in the community.
And now, tell us a little bit about drug court.
Drug court is growing. I'm really happy about how it has. We started drug court through the pandemic, and when we did our training, the trainers said that they don't know how we got a drug court up and running through the pandemic, and they were just very pleased with Alleghany County to get that up and running in the City of Covington. But it has grown to about 14 individuals, and those are individuals who would be incarcerated right now, serving time in jail if we didn't have the drug court. They come in each week to see the judge, and also we have treatment team meetings to talk about their progress and how well they're doing. And if some of them slip, we give them the extra reinforcement so that they can continue to be successful. Many of them are coming into our services 2 to 3 times a week, and then they're also working through probation and parole to get drug tested randomly throughout the week. We've seen a lot of successes. We have people that are moving. There's like 5 to 6 phases of drug court, and we have individuals that are moving from the first phase into the second phase, and some of them are on track to graduate in the time frame that they're supposed to graduate. We're looking at anywhere from 15 months to 24 months for a successful drug court completion. And we've also written a grant with the Alleghany Foundation, and they've approved it to allow us to have some coaches to help them with literacy, and also to help them with GED services and help them with job training and those kinds of things so that they can be successful. And many of the individuals that have been in drug court, we've helped them to find housing, and we've also helped them to get training through job services or also through education training. So it has been very successful. Our goal is to get up to 25 individuals. I'd like to see us have 2 sets of drug court. Of course, if we do that, we would have to have a judge to be available to meet with them. But we've had a lot of successes, and the successes have been better than the failures. There have been a few people where this has not been a good fit for them, but for the most part, it has been a good fit for those individuals. So we're not paying for those individuals to be incarcerated. They're in the community, and they are getting better as far as treatment.
You have any questions?
Yeah, I do. Ingrid?
Yes, sir.
On our voluntary and involuntary commitments, what's available now? Because I know they shut down a lot of the hospitals.
Yes.
Where are people going?
Thank you for that question. It's been really sad. Around 2 weeks ago, the commissioner had to close the state hospitals. 5 of them were closed due to safety violations and also lack of staff. Everybody's having a problem with staff across the Commonwealth. And right now, we've been working with a lot of private hospitals to find placement, or we're trying to keep them in the community if possible. I will tell you that on average, 44 individuals are being left in the ERs at local hospitals because there's not placements. They did open up Catawba State Hospital last week for some admissions, a few, and then also we got an email notification that Western State was going to be open, and that's the one that we usually deal with, to some admissions, but they have caps on the numbers due to the staffing and also due to safety because they can't keep it at the census that they normally have it at. So we're working really hard to try to make sure that our folks have the wraparound services in the community that they need. And in addition to having the wraparound services, if we feel that they need placement, whether it be for inpatient detox or whether it be for hospitalization, we're working with the Virginia Association of Hospital Associations and working with the private hospitals to find placements as beds are available. But it has been very tough on our system to find placement.
Thank you.
Good question.
For those who may not know, explain the process if somebody gets busted for drugs, how they get involved in drug court.
So,
Drug court, I guess how you say.
if someone is arrested, the first thing they need to do is work with their attorney to get in touch with the Commonwealth attorney so that they can discuss a plea agreement so that it can be approved, and then their name is brought before the drug court panel to see if they would be a good fit. And, once the Commonwealth attorney makes a determination that they are a good fit for the program, then they usually work out a plea agreement between the attorneys to get them started in drug court. And that's when we do an assessment. A clinical assessment's done in addition to like an intake assessment to find out if they're going to be a good fit, and then also to determine what services they would need, whether they would need medicated assisted treatment, whether they would need motivational enhancement, anger management, whatever kind of, and we would put them in those services. Mm-hmm.
I have one question. What services are currently being offered in the regional jail?
In the regional jail, we're providing psych services, and in addition, due to COVID, we haven't been able to be in the jail, but we are doing what they call motivational groups with inmates. And then we also have a medicated assisted treatment program that we're working in the jail for those who have substance abuse problems. We are not using Suboxone in the jails. We're using an injectable inhibitor, and what it does is it inhibits people from wanting the drug. And we have written it into a grant to try to get at least 2 doses for those individuals that are in the jail upon release, and then they're connected with services with us to see if they need to have continuation of services under substance use. We have psych services that are being done, evaluations, and they also do initial screenings in the jail for those who may or may not need the services. And then a lot of the groups that are done in the jail, we try to separate those by gender specific groups, so the women are separated from the males when we do those groups in the jail.
Thank you.
Welcome.
Ms. Hernandez, I believe that brings us to board report. Don't mind it.
I was waiting for a motion to approve her.
Yeah, are you going to approve my performance contract?
That's on the agenda. No, you added stuff to the agenda, so we can.
No, it's already under new business.
Okay.